Hello everybody and welcome to the HacettepePathology.com, and in this month I'm going to present two head and neck cases. And the first one is a 35-year-old male with a buccal mass, and the tumor, this is the surface non-keratinizing squamous epithelium, and tumor is composed of these islands of cells and some cords and trabeculae within this desmoplastic background. We have these islands of cells in this power. They seem to be a small blue round cell tumor, and here more solid areas, and it's formed just like the jigsaw pattern here. And when we come to the higher magnification, we see the blue round blue cell tumor with monotonous nuclei, and some of the islets has this palisading like zones, although they are not so conspicuous. So here again some palisades, but we have also necrotic areas, and here the pitfall was keratin positivity. And let me show the keratin staining here. Especially in the head and neck region, we have two mesenchymal tumors expressing keratin. One is this case, and the other one is epithelioid and spindle cell rhabdomyosarcoma, and here the keratin is positive, as well as P40 was also positive. However, if you know this entity called adamantinoma like Ewing sarcoma, you will end up, of course, with having this NKX 2.2 staining, and which stains diffuse and strong nuclear expression, and CD99 was also diffuse and membranous positive. So the diagnosis is also confirmed by EWSR FISH study, and in this case we see at least two cells with separate green and red signals. And in the second case, it was again the same age. No, actually it was like 50 years old female with, again, in the head and neck. It was more like solid and cystic mass here, and again we have some we have surface and we have some relation, but not a direct one, and we have this tumor within this cystic area. We also have some resemblance to the adamantinoma like Ewing sarcoma, like here there's some islands within the desmoplastic stroma, but here we have some cystic spaces filled with solid and papillary formations. And when we come closer, let me show you here. So when we come closer, we see these papillary formations, which is highlighted with the fibrovascular core, and we have some resemblance to the small round cell tumors, as you see here, but they look more like epithelioid, and in some areas we have some here, as you see, some squamoid component here, more small round cell tumor like areas, and we have some more squamoid areas if we can find them. Yeah, here it looks like they look like squamous intermediate maybe cells, and and in this case we have, of course, a differential diagnosis of Ewing sarcoma, like adamantinoma like Ewing sarcoma, or other small, here again some squamoid areas, and some maybe you can also have also we have some, like here, secretion like areas, secretion, and of course not midline carcinoma is in the differential, but not was negative, as you see here. Again, this case also was positive for P63 and pancytokeratin here, and it was negative for NKX 2.2. So Ewing sarcoma is not likely diagnosis, and EWSR was also negative. FISH was also negative, and we did mucicarmine, and as you see here, so mucin was positive, as you see here, and here again. So this case's diagnosis, it was consistent with mucoepidermoid carcinoma. So I hope you enjoyed these two cases, and I will be glad to see you in next month. Thank you.